It is not easy to be a caregiver for someone that you love. It's hard to see them going through what they have to go through. And a lot of times very paralyzing that there's not a whole lot you can do. And what you can do is be that emotional support for them. Hi, this is Liz from the Health Navigators, and today I wanted to do a little chat with you caregivers out there. A lot of times we talk with the patients and we talk about building community and all the different offerings that we have at Health Navigators for the patient. But as a non-cancer patient myself, I've acted in that caregiving role in different scenarios with my sister, and I currently have a very dear friend going through treatment as well. And I just wanted to bring a few insights in that might be helpful, and also, invite you to consider that caregiving does not always mean the direct spouse or partner. Caregiving can look like a lot of different roles. There's siblings, there's adult children, there's best friends, there's parents. So it really depends on each person's unique situation, what kind of caregiver they really end up leaning on, and hopefully for their sake, many people are involved in the process. There's just a lot to take in when someone you love receives a diagnosis. I like to equate it to getting on a roller coaster. There's some times where it's kind of smooth sailing, and then there's times where we hit really high highs with great news and optimism and hope. And then there are lots of times where we can fall down into that place of fear, whether it's just news or looking at a prognosis or what's ahead or the timeline. There's so many different things that can affect both the patient and the caregiver. And also the caregiver is managing their own emotions and their own story while giving as much energy and love as they can to the person that is in treatment or undergoing care of some kind for a diagnosis. It's important to think about that. This is a ride, it's a long ride, and it is not something that if you feel those high highs and those low lows, you can definitely get burnt out. So some really good ways to care for yourself while caring for your loved one is really to embody that self-care, that paying attention to the different emotions that you feel and not allowing yourself to put your own self-care aside, because ultimately your patient needs the best version of you. They need your emotional resilience. They need your physical strength, perhaps at times. They need your optimism. They need your emotional state to be high so that they can reflect that back. And the best way for you to do that is really to stay in tune with your own personal activities. And the way I recommend doing that, and what has worked for me, has been to really look at those 10 radical remission healing factors, right? There's 3 physical, there's emotional factors, there are mental factors, and there are spiritual factors. And leaning into those different 10 attributes really allows you a well-rounded approach to keeping yourself whole, so that you have the bandwidth to take on whatever it is that your patient needs. And we'll always hear on airplanes when we go for a plane ride, right? We need to put our own oxygen mask on first before we help others. That's really an important message in life, right? We need to take care of ourselves, our heart, our mind, our body, our spirit, and really stay in touch with what it is that we need to keep ourselves feeling good, so that we are in a place where we can truly support the person that they need, and we can meet them wherever they are, whether it's a good day or a bad day or just an average day, and everybody kind of feels a little normal. So ways to keep tapping into that, really embracing all of the emotions, and maybe not leaning on your patient with your emotions. You can lean on very, very different variety of people. There's always therapists for that. There's coaches for that. There's maybe if you're in a religious community, you can lean on one of the spiritual leaders, best friends, your own parents, your own personal support group. I really recommend doing that so that if you can lean on them and other people that can help you support your loved one, then they get a chance to spend time with the loved one. You allow them in, and it gives you a little bit of a break, because one thing that does happen with caregiving is people get very afraid of leaving their patient or their loved one in the hands of someone else, or leaving them, period. They really just want to stay connected to them, almost in a codependent way, to make sure that they're getting every possible minute with them that they can. So keep in mind that giving your loved one space is also good for them, allowing other people to come in. It gives them different, stories to hear, stories to share, different people that just kind of give them different experiences. It keeps their routine from getting kind of stagnant and in a rut. And, some of the best success stories that I hear are from people that have just a huge circle of, you have neighbors bringing over food, or you have friends that are going to come and take your loved one to an appointment for you. Or if you don't have to be at every appointment, are there different appointments that are more routine that they can take them for? Maybe it's blood work, maybe it's for a scan, the physical stuff, as it comes up. Hopefully there are other people that can help you with that so that you can get that break and really focus on keeping yourself whole, keeping that mind, body, and spirit in check. There's a lot of different outlets for you to find your own support. But what I recommend is doing something so that your patient can really feel that they will allow you to still be their spouse or their sibling or their child or their daughter or their son, allowing people to step in the roles so that you can step away and they can still feel supported and let different emotions out to different people in different roles. And it'll allow you to do the same. So if you can keep yourself in some kind of fitness routine because that's a really good stress reduction for you, then I recommend doing that. Embracing that diet change for your partner can also have really great positive effects on your diet and your physical health as well. And if you can get as much sleep as possible and keep that diet and that exercise in shape and in check, then it'll allow you to have more bandwidth throughout the day to both give yourself self-care that you need and support your loved one. Different outlets for you to find the kind of emotional support you may need if you need something beyond your own support group. Not everybody has a big group. Sometimes they might have just moved and they don't even really know anyone. So lean on the people that you do have, but if not, don't be afraid to hire. There is a great therapy out there for people that just allows you to kind of put all of your emotions out there so that you don't have to bring that home, and gives you that energetic release that you may need. If you're not into therapy, there are different things. We offer healing circles at our community, and there's also Healing Circles Global that has a healing circle offered for specifically just for caregivers. And that is a free event that is all done virtually. You just need to find yourself a little bit of time and prioritize that for yourself so that you do have that time to just unload in some way. It is not easy to be a caregiver for someone that you love. It's hard to see them going through what they have to go through, and a lot of times very paralyzing that there's not a whole lot you can do. And what you can do is be that emotional support for them. Keeping those healing factors really close. I'll just read through them for you as we have them. We have our 3 physical, we have exercise, diet change, and herbs and supplements. Those herbs and supplements from a caregiver's perspective could be something like some kind of natural sleep aid, or maybe you need something for anxiety. So utilizing different practitioners to help you diagnose and treat different emotions that you may be feeling or some physical things that you may be feeling. And then we have our increasing positive emotions and releasing suppressed emotions. We talked a little bit about how those things need to come into play, and using that time when you are with your patient and doing things that are maybe silly or fun. I went to a chemo session with a friend of mine recently, and we opened up the laptop and we put on some comedy so that we could feel a little bit normal and just kind of watch something funny while we were sitting through her 3-hour infusion. And there's just ways that you can bring these things into your everyday that will help keep both of you in a positive state. And remember, all of these things are activating our happy hormones in our body and infusing us with immune support. So everybody needs that. We talked a little bit about with the therapy and, different support groups and healing circles and different things like that. Another one that's very interesting to consider are, these mental factors. We have strong reasons for living. What is your purpose? And right now you are living in a very specific way where you are supporting someone that you love, and that can feel like a very important purpose. But I also recommend you to kind of look a little further out, maybe a year, maybe 5 years out, and think about what it is that you as a person really want to stay connected to. And that might help you with your downtime. Even if you're just staying at home with your loved one, what are things that interest you that can kind of keep you in an upbeat place, in an upbeat mental space? Obviously, we have our increasing social support factor. We talked about how many different ways that people can kind of come in and help you. There are lots of websites out there. If you are just tired of telling the same story over and over again, you can tap into the website Caring Bridge, where you can speak directly to those you've invited to your profile, and you can tell them exactly what you want them to know, whether it's medical updates, whether it's things that just the thoughts and wishes of the person that is in healing. Maybe they need visitors, maybe they need uplifting little notes or texts to be sent, and you can utilize Caring Bridge as a way to communicate with everyone in your circle all at once, so you don't have to make repeated phone calls over and over again to share this information. There's also lots of ways for people to help you if you want to use a meal train app, or there's lots of helping hands. These are things where you can kind of go and let your community sign up for different things that you need. It allows you to not have to ask so many people and just lets everyone say yes at their level of comfort. So lots of websites out there. So use that with your social support system. And if you don't have one and you're, part of a different organization or a different church or even work, don't hesitate to bring those people in too, because you might be surprised how many people are there that want to help you in a way that you may never have known if you didn't ask. And we also want to talk about the spiritual factors, tapping into your intuition. These are factors we talk to our patients and our clients to utilize, but they are very important too. Having faith and hope really brings a deep sense of peace. And it can be really challenging when you're seeing so many high highs and so many low lows on this kind of roller coaster we talked about. So trying to stay as even as possible and tapping into that spiritual connection so that you can feel connected with something greater than yourself, and don't put all the responsibility of care on you. There is something out there that's greater than us, whether you believe that is in a spiritual or religious sense, whether there's a God for you, whether it's kind of just nature and you feel like kind of one with the planet. There's a lot of different ways that can show up, but making sure that you spend time tapping into your spiritual connection so that you can have that sense of calm to present back to your patient. And I just wanted to kind of tap into those healing factors for the caregiver side. Again, I've used them a lot for my own healing. It's really been proven to be very helpful for my mental state, my physical state, and my emotional state to really allow me the bandwidth to show up in a very strong way for the people that I love when they need me. So hopefully that has been helpful. If you need to tap into that a little bit more, Carla and I are always here for coaching. If you want to set up a time for a discovery session, you can certainly do that with the link in the notes, or visit us at healthnavs.com. But please go ahead and follow us on all of our social media, on Instagram, on Facebook, obviously on YouTube, and continue to subscribe and follow our channels, because we always have more information that's coming out. And while we may be speaking to the patient a lot of times, internalize a lot of that, because it really can apply to you as well. So I look forward to connecting with you in the future.